Mr. Grady's Ag Science class. We are the Buhler FFA Vet Science team. I'm Heather.
I'm Dakota.
I'm Jacob.
And I'm Bailey.
Today we are going to be showing you some veterinary procedures.
In this video we'll be using the following materials: a cotton ball saturated with alcohol, a vial of Banamine, a label, a syringe, and a needle. We will be using a 20 milliliter syringe with a 20 gauge, 1.5 inch needle. This size is used for intravenous injections in horses. We will be placing the label onto the distal barrel of the syringe that has the amount withdrawn, date, patient's name, and veterinarian's initials.
Hello, this is our patient Nitro, a 10-year-old American Quarter Horse gelding. Nitro will be receiving 11 milliliters of Banamine injectable solution for the treatment of early onset colic. Nitro will be given this injection intravenously into his jugular vein. Banamine injectable solution is a potent, non-narcotic, non-steroidal analgesic agent with anti-inflammatory activity. It is recommended for the alleviation of inflammation and associated pain in musculoskeletal disorders, with the alleviation of visceral pain associated with colic in horses. Nitro, who weighs approximately 1,100 pounds, will be receiving 0.5 milligrams per pound or 1 milliliter per 100 pounds. In total, he will receive a dose of 11 milliliters. We will place the label that has been prepared beforehand on the distal end of the syringe.
Next, she will take a cotton ball that is saturated with alcohol and wipe the rubber stopper area of the vial. She is now turning the vial of medicine upside down, holding it with a firm grip. Now she will insert the needle into the vial and withdraw 11 milliliters. After the correct amount is withdrawn, she will remove the needle from the vial and gently tap the end of the syringe to remove any air bubbles that may be present. Now that the injection is ready, she will notify the veterinarian so that he can give the intravenous injection, because this medication can only be administered by veterinarians. Moving to the horse, she is now showing the injection site, which is located in the top quarter of the horse's neck. The jugular furrow is the chosen location because it is where the carotid artery is the furthest from the jugular vein.
Let's go over the materials needed for this procedure. Our patient's wound is bandaged with the vet wrap and gauze. It's important to know this information so we can prepare the correct tools. Our materials are minimal, needing only the bandage scissors and a secure trash can. Hello, this is our patient Logan. She is a 4-year-old Australian Shepherd. She has a superficial wound on her leg from an aggressive feline. Her wound has been healing for the past week. It is now time to remove the bandage so the vet can check its progress. First, I will settle the patient so that I can safely remove the bandage. I will start at the proximal end of the bandage. This is the end closest to the dog's body, and cut distally, or towards the dog's paw.
To begin the removal, she will place the blunt, rounded side of the scissors against the dog's skin, with the end slightly under the bandage. After this is complete, she will raise the scissors slightly so that the blade is in contact with the scissors. When she has the scissors positioned correctly, she will slide the scissors under the layer of the bandage, which is made up of vet wrap and gauze. Once these steps are complete, it is time to begin the cutting. She will cut away from the dog. As she is cutting, she will peel the bandage away using a firm hand. When removing the bandage, she will take extreme care to avoid any unnecessary pain. As she does this, she will remove each layer of the bandage, the vet wrap, and the gauze below.
Good.
Now that the bandage has been successfully removed, she will need to notify the veterinarian so that he can check the wound.
Dr. Vet, the patient is ready for you.
After the patient is safely on their way, she will need to clean the work area. First, she will dispose of the bandage into a secure trash can, and then she will sanitize the area and all the tools used.
procedures, we hope that you have learned something. Thank you for being an attentive audience. Here's a quiz to test your knowledge.